Thanks for bringing the good weather. And we're glad you came anyway, because we were afraid everybody was going to go to the trail ride. It's too muddy for that. Good choice to come. I'm Mike Erskine. I'm the director of the Equine Medical Center. It's my honor and privilege to welcome all of you to this event. It kind of came along in an interesting way, I think, if I could just share. Karen Jones Squires is the chair of our advisory council, and she's also affiliated with Kirsten's group, Retired Racehorse Project, and she put us together. And while she was putting us together, we realized that we already knew each other. So this is kind of a nice reintroduction with Kirsten. But we're thrilled to have you. We've got 3 super speakers today. Very important topics, I think, as far as promoting the second careers for our racehorses. I think really great for the racehorses, of course, for the racing community, and most importantly for you guys as far as sport horse and pleasure horse owners. So welcome, and turn it over to Kirsten.
Thank you. Good morning. Thank you for being with us. I'm Kirsten Green. I'm the executive director of the Retired Racehorse Project, and likewise would like to thank Karen Jones Squires for kind of being the catalyst of putting this together. And Mike is very kind. Last time I saw Mike, I was probably 17 years old, and he was our farm vet. Didn't have this job just yet, and I didn't have this job yet either, so it took a little while. But thank you for being here. We're very excited to do something kind of like on our home turf. We're based out of Maryland, so this is very much kind of our region, and we're glad to be doing something here kind of in such a well-recognized institution. So thank you for hosting us. And just a couple of little housekeeping things if you missed it on the way in. The restroom is just kind of out the door to the right. Excuse yourself at any time if you need a snack or a drink. There's coolers and everything out there. We will be walking down to the arena for the kind of second portion of this presentation, probably in about like an hour or so, and then we'll come back up here for lunch. Okay? If you have any need for like assistance with mobility getting down there, please just let us know. We can help with transport. And without further ado, I'll just take a moment to introduce Dr. Jeff Berk. Dr. Berk began his veterinary career as a racetrack practitioner and subsequently started a practice in Ocala, Florida, specializing in young horses and training and thoroughbred sales work. A past president of the American Association of Equine Practitioners, he's also served as AAEP treasurer, board member, and chair of the AAEP Foundation Advisory Council. Dr. Berk is a board member of the Thoroughbred Aftercare Alliance and Light Up Racing. A graduate of the University of Pennsylvania School of Veterinary Medicine, Dr. Berk was previously a partner at Ocala Equine Hospital and is currently residing and practicing in Lexington, Kentucky. His primary focus is international thoroughbred sales work, as well as work with New Vocations, the largest thoroughbred aftercare facility in North America. And I can't underscore enough how much Dr. Berk does in the thoroughbred aftercare space. It is really truly an honor that he was able to join us for this. The amount of exposure and time and effort that he has put into improving outcomes and just elevating the work that we do in aftercare really just can't be understated. So thank you, Dr. Berk, for being with us today.
Thanks for having me. It's really thank you. It's really a pleasure to be here, and it's actually not my first time here because I work with the folks here at Virginia Tech on an advisory committee to help the university make decisions about how they're going to be spending money that's coming in from the historic horse racing revenues that come into Virginia. So it's really great to be back. Thanks for the introduction, Kirsten, and as she mentioned, my name's Jeff Berk. I'm an equine veterinarian based in Lexington, and I'm just going to be discussing with you basically what I've got for you today is a lot of this has come from a previous presentation that I did for the AAP a few years ago on the evaluation of the thoroughbred for a second career once they come off of the racetrack. So we're not going to go through every single thing on this, but I thought it would be nice for you to have this. And also, I just want to say up front, there's a couple of resource materials that Kirsten is going to make available to everybody. And so in addition to that, you're welcome to have this PowerPoint. So you don't need to be taking a lot of notes. I think it'd be easier and more fun for you to just listen and not have to write a bunch of stuff down. There's just a lot of information there. So I put this slide up first, and these are things that you all know. Can I, first of all, can I get kind of I'm assuming that many people in this room are actively involved in aftercare, in bringing horses off the track. Would that be right? Okay, yeah, that's what I assumed. Okay, that's great. So I really want to tailor my comments to you because, as Kirsten mentioned, I'm on the board of the Thoroughbred Aftercare Alliance, but I also fully realize that there are a number of very good individuals and groups that take horses off the track that are not under that umbrella. So I don't want anybody to think that I think that it's some kind of an exclusive club. Probably 2/3 of the horses that come off the track in the United States and get adopted out are through individuals or organizations that are not affiliated with the TAA. So I don't think that doesn't matter. I'm sure everybody's doing a good job. So this is more tailored toward everybody, not just an exclusive group. So this is a topic. Well, let me back up a little bit. Here's what I want to discuss with you today. There's basically, I want to talk about the role of the veterinarian in aftercare as part of your team, and as the person to help provide information to assist you in the decision making. It's not the vet's job to do the decision making, but to give you information that's going to be helpful to guide you as you're adopting horses out. I want to make you aware of some resources that are available. There's the AAP Racing Committee a few years ago put together some aftercare guidelines that I think are very helpful and valuable, and there's a form that I think you'll be interested in, and I'll explain why you might be interested. We're going to go through some case studies, both positive and negative, to try to give you an idea of outcomes on some of these horses, what they can live with when they come off the track and what they can't. And then we'll finish up with some take-home points. So let's see. So I think you're all familiar with the term social license to operate, and it's the sort of license that's granted to any sport by the public in order to operate. So the aftercare piece has become central to everything, to racing and breeding. There was a time not too long ago where aftercare was almost like an afterthought, and only certain people were even interested in it. But it's become obvious now that in order for racing, thoroughbred racing and breeding to continue to function, this has to be a central piece of the whole thing. And people so there's been an increasing awareness of this. I just got back from a couple of conferences in Saudi Arabia. One was called IFAR, and I'm sure a lot of you have attended it. It's in a different place every year. This year it was in Saudi Arabia because the Saudis are trying to go from sort of 0 to 60 very quickly as far as their aftercare, and they've constructed a very good program under the auspices of their veterinary welfare officer, a veterinarian named Francesca Compostela. And so they had the IFAR conference there, a one-day conference, and then the Asian Racing Conference. And the reason that I bring up the Asian Racing Conference is ordinarily it's boring. It's just about wagering and things that most of us care nothing about. But this year there was a real focus on aftercare, and you can see the trend, the way that we're trending, that this is becoming a very central part of the whole of thoroughbred breeding and racing. So I want you to really understand how important it is what you're doing. It essentially is the underpinning of the entire industry. What's that? Okay. So just, I already kind of prefaced things about the TAA, and I realize that there's many great organizations that are not under the umbrella of the TAA, but just to give you the magnitude of what's going on within that, they've granted over $41 million to accredited organizations and about over 20,000 thoroughbreds have been retrained, rehomed, or retired by these organizations. There's about 86 different organizations under that umbrella, and some of them have multiple facilities, so about 175 actual facilities. I'm not going to go too much into the new vocation stuff because, you know, you being the audience, you're all well aware, you're already doing all the same things. I just want to kind of launch into the veterinary part of it. So essentially what I do is when I go out to the farm, New Vocations is in Lexington, and I go out there quite a bit to look at horses. They typically email me the night before or a few days before a list of horses that they would like me to look at. And so with all of the information, and I get quite a bit of information, which is really helpful, not just the name of the horse and the age, sex, etc., but the race record, a record of who had the horse, the trainer, the owner. I also get any historical information as far as imaging, you know, the reason for the horse being taken off the track, hopefully. I mean, this is not always complete in every case, but they give me everything that they have, and they try to get as much as they can. And so I'll get x-rays, ultrasounds of, you know, descriptions of injuries, things like that. So I have a reasonably good idea of when I get to the farm of what I'm going to be looking at. So that's just, it doesn't necessarily influence my process as much as it just gives me a lot of information as I'm going through my exam process. So let me get to okay, so I pretty much follow the same protocol for each horse. Let's see, I think I got a little ahead of myself there. I'm trying to assess whether there's any detectable level of lameness. I'm trying to determine the relevance of any previously diagnosed injuries, and hopefully I'm getting that information the night before I look at the horse. And then, of course, I'm trying to discover any undiagnosed injuries. So that's the basis of the initial plan for the horse. And in each case, follow-up will determine the disciplines available for each individual horse and the rate at which the training should proceed. So the slide that I've got up now and the next few slides are taken from the AAEP guidelines for equine practitioners, adoption organizations, and horse owners. It's called Transitioning the Retired Racehorse, and there are a few points that I've pulled out of the document for our discussion today. Again, this will be available to you, so you don't need to be copying any of this stuff down. It's just basically going into the role that equine veterinarians play in helping to transition these horses. So, as I said, probably the most important part of the vet's role is an accurate assessment of any lameness issues that the horse might have, as well as an understanding of how those issues might affect or limit a second career. The document points to the fact that there isn't much scientific data to go on when we're trying to give an assessment of future usefulness of any given horse. And that's important for reasons which I'm going to tell you in a minute here. It's evident that as we are able to improve how we document the injuries and outcomes, the data that results will help us to be more accurate to that effort. So I'm going to refer back to this when we discuss the veterinary evaluation form, which will be coming up. In the AAP guidelines, the first step in determining the prognosis for a racehorse to be transitioned to another use is a comprehensive evaluation. The depth of that evaluation will, to some degree, be determined by the level of horsemanship at the retraining facility. So I'm very lucky. Anna Ford is the director at New Vocations, and she's got a very well-trained staff there. And so it makes my job a lot easier. And I don't want you to think that every horse that comes in to New Vocations gets examined by me or by a veterinarian, because there are many horses, as you all well know, that come off the track and they, to the knowledge of the people sending them to you and to your own assessment, the horse may be perfectly sound. Sometimes horses are just slow and they're not suited to be race horses. And so I don't look at those horses. That's not really part of my job with them. They do many of their own assessments, and when they assess that a horse, either based on the history or based on what they're seeing, needs a veterinary evaluation, then that horse would be on my list. So money is obviously a big issue, and we're going to talk about that. But for this work, as you well know, to be done efficiently, different horses have different needs and require different time frames in order to go through that process. And so in the best case scenario, a horse comes off the racetrack and they have no medical history of any injuries. They're maybe just not suited to racing, and they come in and they appear to be sound and they go right into the program. And those horses can be, they start doing some groundwork. They're slowly enter into the initial training process, and at any point along the way, they're available to be adopted. And you'd be hoping that within 60 to 90 days, those horses would have entered a level of training where they would be desirable for someone to adopt, and they'd come and adopt them, and that would be the simplest and cleanest scenario. Obviously, not all horses are like that, and so the longer you have a horse, obviously the more expensive it is, and everyone is dealing with that issue of getting enough money to take care of these horses. So the reason I bring it up is on the other end of the scale, there are some horses that have significant enough issues that they're not even suitable for the program. And so in the most extreme case, some of these horses really, from a humane standpoint, would best be euthanized. And that can be an occasional recommendation that I might make based on what I'm seeing. And we'll go through a couple of those. So there's no hard and fast rules here, but just in an attempt to try to sort horses out initially, those are the definitions that the AAP has used for horses in terms of where they may end up in terms of usefulness based on the veterinary evaluation. And you can see level 1 is the lowest level, and those are horses that are usually either injured to a point or maybe have some chronic issues that have gone beyond the point of them being useful for an athletic career. Level 2, light use, trail riding, occasional trot. Level 3, moderate use, and then level 4, full athletic work, no exclusions. So at New Vocations, in their intake process, they use similar but more comprehensive system of categorization, and you'll see that in a later slide. So the guidelines refer to the importance of a horse's temperament. And the vet may have some input here, but the evaluation of the horse's temperament, as well as its suitability for a particular adopter, is primarily the responsibility of the program director and their staff. So this is just, when this presentation, when I did this, it was with Anna Ford, and so the next few slides basically were her talking, but I just wanted to go through them very quickly. As I mentioned already, the initial evaluation is done by the program director, and then it goes one of two ways. The horse either goes directly into training, or I would get called to evaluate the horse. This slide is basically just talking about that transitional period, and I do want to emphasize that even in the best of cases, when horses are coming off the racetrack, they are very much creatures of habit, and they're used to being in a stall and exercised for a short period of time and then back in the stall. And so this period of, I'm going to say approximately 60 days, so there's no magic number there, but that period of time is very good for these horses for a couple of reasons. It's good for them physically because any little nagging ailments that have been maybe as yet unidentified have an opportunity to heal up, turn out as very good for horses, and also for their minds. They really benefit from not just being out and moving, but also getting into sort of more of a herd dynamic. So they're eventually out with other horses, not necessarily initially, and everybody has their own program, which I'm sure is very good and tailored to your unique situation. But I think that that's a really important part of the process for these horses coming off the track, because you have to realize at every point along the way with a thoroughbred, even though they're bred for the purpose of racing, their racing career is actually short compared to their entire lifespan. And so, and that's one thing that I think people are starting to catch on to, is that even though they're bred for racing, it's unfair to just focus on that part of their life and discard them afterwards. And so these are, in my opinion, the best horses that there are on the earth. And you'd say, well, why do you think that? Because, well, I've had them, I've ridden them. As a matter of fact, my friend Greg Ryan is here in the room, and Greg and I fox hunted for a number of years together. And I sent my thoroughbred up to Middleburg to learn how to fox hunt. And they're intelligent, and they're brave, and they're athletic. And so these horses deserve to be treated in a way that's appropriate to them, to respect them. And so just because you own a thoroughbred to maybe pinhook, you buy a yearling, sell it as a 2-year-old. You buy a 2-year-old and you're racing it for a year or 2 or 5. By the time that horse has gone through the cycle and is done, people may not have a financial obligation to those horses, but they have an ethical obligation to those horses. And so everybody along the way that's involved with these horses has a responsibility toward them. And so if a horse gets done racing, and I mean, it's a bit discouraging when I go and I look at some of these horses and I see that the horse sold for $700,000 as a yearling and it has 0 starts. And is broken, you know, like has a significant injury. And so there's an increasing awareness now that the entire industry is responsible for these horses. And we're trying to even extend that financially in the sense of increasing the amount of money that sales companies are donating to aftercare. And I'll go through some of the efforts later on as far as the money part of it. But at any rate, we're now seeing that people are learning. It's an educational process, learning that just because a horse is done racing doesn't mean it drops off the face of the earth. Let's see, that's slide 13. So the veterinarian's role in all of this. After a good, thorough assessment, create a rehabilitation plan for each horse. So these are obviously individualized plans. There's no one plan that fits all horses. It's completely dependent on a number of things that we've already talked about. Some of it has to do with previous injuries. Some of it has to do with undiagnosed injuries. Some of it has to do with the horse's temperament. And I think I'll mention it later on, but in case I forget, all of these horses need to, if they're colts, they need to be gelded, period. And it's helpful for the folks at New Vocations if when I do my report, there's no way to be precise about what each horse can attain to. But I think we have a pretty good idea going into it what might preclude them from certain things. And so I basically try to list any limitations on a full athletic career that might be posed, and so that when they're trying to match somebody that wants to adopt the horse to the horse, that they know right up front that here are the limitations that might, if it's an experienced eventer that wants a really nice thoroughbred to event at a high level, they're not going to be able to adopt a horse that has already had some degenerative joint disease in its front ankles. And so that's part of the job of the veterinarian. And as I said, some of these horses need to be permanently retired or euthanized. So I gave you the AAP guidelines for the horse levels, and this will be, you don't need to scrutinize this too heavily. As a matter of fact, I don't know how well you can see it from the back. But don't worry about it. You can look at it at your leisure. You can all have this PowerPoint. And basically what you'll see are different categories. So it's more than just whether the horse has been injured or not. And a lot of it is once the horse goes into training, the horse's general demeanor, how they are when they're being groomed and tacked up, leading ground manners, physical capability, etc. This is an assessment that they make there based on all of these factors. So you can have a look at that at your convenience. So I mentioned that they send me the images and the available history the night before. A lot of my examination is very standard, just as you would imagine. So basically, what am I doing? Nothing super fancy. I'm basically watching the horse walk and trot to see if it's sound. And you got to realize too that you have to take it a little bit with a grain of salt, because sometimes their feet are in bad shape, and so they might be a little bit footsore. And so is the horse really lame, or is it just kind of a little bit tender on its feet? So we just try to assess the level of soundness the best I can. Obviously, I observe and palpate all of their limbs and their body, flex their joints, etc. And then, as I mentioned, I have the previous information, so I'm trying to zero in on anything that we already know about. But based on my exam, I might find some things that were not in the history that might pertain to the horse's suitability for any given purpose. If the horse is lame, I might do some nerve blocking just to isolate the lameness, and then if I isolate it to the fetlock, I might take some x-rays or ultrasound the suspensory branch. And as I mentioned, they have a number of high-level trained riders there. So if I'm at the racetrack and a rider says something, I usually don't pay any attention to them because they don't know what they're talking about. But when I'm at new vocations, I pay attention to what they're telling me because they're trained and they can feel something that I may not be able to see. So that's kind of my routine. So this is one of the resources, and it's a form. And you'd say, well, why, everybody has a form. What's the difference? Why does it matter? Well, I think I mentioned to you earlier on that in order to progress in terms of our knowledge about what racehorses coming off the track can live with, we have to accumulate data and then do something with it, okay? And there's no way to accumulate data when you don't have consistent terminology in terms of what your diagnosis is. Give you an example. I'm sure you all know the term oscillate, which is kind of an ancient term now, but it basically is an ankle that's used up. I mean, it's big, it doesn't flex well, but there can be a multitude of things in that ankle that are causing that. It can be relative to the front of the first pastern bone. Maybe it's got a P1 chip. Maybe it's got an old fractured sesamoid. Maybe the condyles of the cannon bone are eroded in the back. I mean, there's any number of things. And so in an effort to try to create uniform terminology, The only way to do that is to have a form that has all of the diagnoses in it with checkboxes. So, and it's very easy and quick to use. And you'd say, so who is this for? Well, it can be for one of two people or both. This is a 3-page form, and as you can see, hopefully you can see, and you can study it when you get the PowerPoint. It has fetlock, carpus, hock, etc. All of the common areas where we might find pathology in a racehorse, with a little check next to it. And it has some additional things in there, if we have access to it, the date of the injury, x-rays, ultrasounds, all the stuff that we like to have from a historical perspective. And so this page 1 of the form would be for the veterinarian at the racetrack. So if you're a racetrack trainer, you could have these forms in your office, the vet could check them off, and I'll tell you in a minute where they go. But anyway, this would create a system whereby we could begin to harvest some information that would be useful. So this is the second page of the form, and it's basically identical, but instead of being for the veterinarian at the track, it's for people like me, the veterinarian at the aftercare facility where the horse has been received off of the track. Same thing. So conceivably, you could have this form with the same boxes checked off by 2 different veterinarians. It doesn't mean that it needs to be both. It could be one or the other, but at least it's a way of cataloging what the horses have to the best of our ability. And of course, usually for me, since I'm the second person, I'm probably going to find more stuff because that's my job. So I would fill that in, and then this basically is suitability, the last page. And again, it's I don't want to call it a rough guess, but it's an educated guess. There's no magic to it, and as you'll see in some of these cases, some of these horses can do surprisingly well with some of the injuries that they have sustained at the racetrack. So I just want you to be aware of that form because it's available to you. We're trying to get it into wide usage, and it's just difficult to do because nobody wants to take ownership of it and say, you should do this. And so it's up to people like me to make you aware of this, of its existence, and I think you would find it not only from a selfish standpoint, you would find it useful, but this is our way forward. This is, and you'd say, well, what do you do with all this information? Well, I've talked to the Jockey Club, and they are looking at creating a portal for this information to be uploaded into, and then we can create some research around this. So if we had enough horses with enough of this information, we could start to look at statistically when a horse has a fractured sesamoid that has healed, statistically, how do those horses do? It doesn't mean that on the one horse that you just got into the farm, that's how that horse is going to do. Just like when I'm vetting horses for people to buy, I can't tell them on any given horse that's going to be okay, but what I can tell them is that there's a 90% chance that that's going to be okay. And I think it refines the process and it makes you better at what you're doing. So I think for unselfish reasons as well, it would be great if we could get this form into wide usage in the United States and potentially the world, which I'll tell you about the international efforts in a little while. So let's see here. All right. Okay, so as I mentioned to you already, my report that I give them is pretty simple. It basically says it's always a one-pager. That's pretty critical. You don't want to flood people with information. It's basically used by the organization, the aftercare organization, to help the client match up with the horse. So it has the horse's name, the date that I examined it, the history of the horse coming off the track, my physical examination, any imaging that I do or diagnostics, whether it's nerve blocking or x-rays, ultrasounds, and then a recommendation. And the recommendation, I initially wasn't really making recommendations on paper, but it's been helpful to them to basically, if I say, due to the findings, there will be some limitations to athletic ability going forward, or there are no limitations. And of course, I'm not saying that the horse can become a 5-star eventer, but what I'm saying, because that's based on the horse's ability and talent. And so I'm not making that assessment. They're trying, along the way, they're trying to get an idea of how athletic the horse is. But I'm basically cataloging on my report any significant limitations that I might find. And on an unfortunate occasion, it might be that the horse is either a pasture ornament or needs to be euthanized. And I don't say that lightly, because I'm dismayed sometimes when I see horses coming off the track that need to be euthanized. Okay, so let's go over some cases here. I just want to be cognizant of my time. Mike, 10:30 is my target. Okay, perfect. Okay, so I want to talk about the feet first, and because this was a real learning experience for me. And I think initially I may have been misled because I got so much good information coming off the track that I trusted that it made me zero in on that information. And so this was for the AAP presentation for veterinarians, basically getting imaging the feet on a more regular basis. So this particular case was actually part of my learning process. I examined this mare, came in February of 2020, came to New Vocations with a history of front fetlock issues and radiographs of her fetlocks. I took the radiographs, and she had some mild arthritic changes and a fair bit of filling in her front ankles. So flexion tests were negative. Didn't want to make too much of it. I injected her front ankles with hyaluronic acid and triamcinolone, which is a pretty standard treatment, and examined her again in March. At this point, she was pretty sound at the walk and trot, and the filling in the front ankles was greatly reduced. I recommended that she enter into early training, low-level training, and just monitor her soundness. So 60 days later, in May, I did a follow-up exam, and she had kind of a mild bilateral front lameness. It's pretty mild, and you might call her short-strided. Wasn't really lame. But at that point, I went ahead and took radiographs of her front feet, and you can see there's a radiographs of the lateral view of each front foot, and she's got rotation. So she apparently had a bout of laminitis at the racetrack, and it had gone undetected, and it wasn't, it's still a lot, 6.5 degrees in the left front, 5 degrees in the right front. The point of me telling you all this is that I feel like I wasted about 4 months of time, and therefore a waste of money for the facility, by not paying more attention to the feet. And so this case and others like it have really clued me in that almost, especially if there's any dishing or any external abnormalities of the feet, I just go ahead and x-ray them right from the beginning, because that can, obviously a horse that has rotation of its coffin bones in front is going to be of limited usefulness from an athletic perspective, and maybe a high maintenance, a lot of management going into it. So it's not going to be suitable for the average person wanting to adopt a horse. So let's see here. This is another case where I zeroed in on the history primarily, and let me see, that's slide 22. Yeah. So this horse was retired from racing for issues related to her left knee, and you probably can't, well, actually I can show you. I've got a pointer here. That's the bottom of the radiocarpal bone. That is the most significant area in the horse's knee in terms of having any kind of pathology. And so she obviously had some pretty significant issues of her knees, and this is her third carpal bone, and it looks like Swiss cheese. So this horse is done. This horse is done racing. There's no future options for racing. But as you'll see in a few knee cases later on, a lot of these knees do pretty well for second career. So I wasn't overly concerned from that standpoint. I did x-ray her feet though, and at this point I'd gotten more accustomed to doing that proactively, and she has 7 degrees rotation in her left front foot and 4 degrees in the right front. And had we just pursued hoof trimming without taking x-rays, we might have wasted several months of time and money on this horse. She just became a broodmare, and that's fine, and she was comfortable being that, but it just kind of illustrates the importance of really bearing down on getting their feet looked at in a critical way like that. So this horse had a sesamoid fracture at the track, an apical fragment. Surgery was done to remove the fragment. There was a vague history of foot soreness, and when I examined her, she was lame in both front. So obviously went ahead and x-rayed the feet, and she has P3 rotation as well. And you can see on the front of P3 right there and right there, and then you got some, those are chronic changes, okay? That's not something that happens overnight. So this horse, obviously, as some of them, the laminitis was not identified at the racetrack, and the horse came in like that. So it's just, the reason that I'm bringing these cases to your attention is I think that eventually you probably will figure out that it's the horse's foot that's bothering it, but we want to try to be as efficient with our time and money as possible. So it's your money ahead to be zeroing in on the feet on these horses when they come in from the racetrack. Excuse me. Another thing that's important that I think flies under the radar is paying attention to the neurologic status of these horses. I think you'd be surprised at the number of horses that are racing that have very mild neurologic issues that nobody has identified. And it's important for several reasons, but again, you can be misled by the history of the horse. You might have, well, I'll show you. Let me back up. The reason that this is important is because a horse that's even minimally compromised may end up injuring itself because it doesn't know exactly where its limb is placed at a certain point in time. And the stride of a racehorse is a very well orchestrated event, and in microseconds. And if a horse spends a fraction of a second loading a limb too long, it can injure itself. Or if it doesn't know where exactly it's placed its foot, it can injure itself. So this is an important consideration, and a lot of these horses fly under the radar. So this is another one where the history could potentially be misleading. There was a filly came off the track. She had a right front lateral suspensory branch injury 60 days prior. When I looked at her, she was not moving well at the trot, but it was difficult to pinpoint an actual lameness. And I go through a fairly brief but comprehensive neuro exam on these horses. And one of the exams that I use is just a simple limb placement test where, you know, horses like to stand straight. And when you put a horse like this, they don't like it unless they don't know where their legs are. And so on this particular filly, I just made her cross her legs and stand like that, and she just stood like that until I moved her and did it with both. And it was obvious that she really wasn't fully aware of where her front legs were. And so the history of the suspensory branch injury was a little bit misleading if you zeroed in on just that. So I just wanted to bring to your attention that in the process, if you have a horse that you're getting a veterinarian to come in and do an evaluation on, that to me is a very important part of the exam. And it's quick. I mean, you know, we do limb placement tests. I walk next to the horse as it's being walked and with its tail in my hand and just pull it over every once in a while to see what kind of hind end strength they have. And some of them just come right over without me using much effort at all. We circle them. Sometimes we'll walk them downhill without being able to look at their feet, so they're looking into the distance. The various little things, it's pretty quick, but you'd be surprised at some of these horses where that really is the underlying problem. And it's a huge problem because if you identify a horse that's going to be potentially rehomed coming off the racetrack, and you realize and you discover that it is neurologic, even if it's a mild neurologic issue, now all of a sudden you have liability issues as well. And you can't, in good conscience, knowing that a horse has some neurologic issues, the horse could injure itself, but more importantly, the person that's adopting it, the rider, could be injured, and the horse takes a bad step, falls down, something like that. So I think it's a relatively simple but important part of my evaluation when I'm looking at these horses. And the reason I'm bringing it to your attention, I didn't really, when I started looking at these horses coming off the track, it wasn't really in my mind, but I started to put together, especially certain cases where horse gets, I think I have one in here. Yeah, okay, I'm gonna show you this. Yeah, so this is a 3-year-old gelding, had a previous history of multiple limb lamenesses over a period of a year. And they did all kinds of diagnostics, and this horse had an initial injury of the right hind high suspensory, but then more recently stress remodeling and or fractures of both tibias, both front ankles, and the right knee. So this is the kind of horse that teaches you, you'd say, well, why all of these injuries and in different places? And when I examined him, he had abnormal limb placement tests. He was dragging his toes of his hind feet, and you know, he was obviously neurologic and was not really, you know, at that point you just say not suitable for this program. And we've already talked about the liability issues that are associated with that. So those are the main two things that I kind of wanted to introduce to you as far as something that I've found important as I've been dealing with horses coming off the track, the feet, and the neurologic status. I want to look at some specific injuries by type and anatomic location and their outcomes for you so that I can, maybe it's a spoiler alert, but there's no hard and fast correlation to say this type of injury results in this level of limitation and this type of injury is always fine. It doesn't quite work that way, but you'll see. So this is a horse. This is a gelding that was reported to be retiring from racing due to an injury to the right knee. On the physical exam, he was sound at the walk and trot and had normal flexion of both knees and front ankles, and there wasn't any resentment to palpation of the front of the knees. So the radiographs, this is the horse's right knee, and there's a lot of stuff. There's a large old chip off the top of the intermediate carpal bone. Let's see if I can see that myself here. Yeah, right there, non-displaced fragment. There's sclerosis of the radial facet of the third carpal bone. It's mild right here. See that kind of hazy white to it compared to this normal area here. And then the left knee has got a fair bit of pathology on the radial carpal bone, just throughout the carpal bones in general. So this horse was done as a racehorse. But the point in me bringing it up is that you can see that there's a fair bit of pathology there, and yet this horse actually became, it didn't bother him. He became a very nice hunter jumper and had no issues with regard to his knees. So even in a case where you've got some significant pathology in the knee, in this particular case, it had not exceeded a level where it became an issue for him doing another job. And that's the interesting thing about this, is that these horses, as soon as they're done racing, they're starting from zero in a sense. If you, I don't know how many kids you had in your high school class, but I had about 100. And if you lined up all 100 of us and said, you all have to be track athletes, that would not work. Because there might be some really good athletes, but not for running track. And it's the same thing with thoroughbreds. They're, of course, bred to race, but some of them are terrible racehorses. They either are slow or they don't have the mind for it, but they might be really good at other things, like really good. And that's the job of the aftercare facility, is to not only take the horse off the track, get them to nurse up any wounds that they have, but to assess their ability and try to train them to unlock whatever potential they have for a second career. Could be lots of different things. So that was a very satisfying case. The next couple of cases are similar. They're knees, and they're a good illustration of what some of these horses are capable of, in spite of what we would consider important pathology for racing. So this filly was retired from racing due to lameness referable to this knee. And she had a large fragmented chip coming off the bottom of the radiocarpal bone, which I think you can see right there. That, as I said, that's probably the most important area of the knee, the bottom of the radiocarpal bone. So for racing purposes, prognosis would be guarded. I think it'd be worse than that. I think she's done. But there are there's no degenerative changes in the joint, which I think is important. And so this is her. She had a very successful career going over jumps, and very, very nice horse for somebody. Here's the next horse, and this is kind of interesting. So this horse had a slab fracture of the third carpal bone, and you can't see where the fracture was because it's been repaired with 2 screws, and a very good repair. Again, there's no degenerative joint disease associated with it, so the repair is adequate. And again, another nice horse for somebody, quite successful. And I want to make a brief comment on hardware in these horses, because you probably have all gotten horses off the track that have a screw in them somewhere. And they are hard to adopt out because people have the misconception that that's a bad thing. Well, in this case, it certainly wasn't. And in many, many cases, the screw is evidence of a good, solid repair. So it's not, it's an education process, I think, for people that are getting horses from you to begin to understand that this is not a bad thing. And the screws obviously need to remain there. You don't go and take them out. So I guess the take-home point in some of these knee injuries, whether or not they've had surgery, if in the absence of any significant degenerative joint disease, you typically have a positive outcome. These horses can do really well at just about anything. However, it doesn't mean that all knees do well, and sometimes they're tipped over the edge, as this horse was, and you can see this ragged appearance of that radiocarpal bone, and this is long-standing chronic progressive degenerative joint disease. And this is an example of what we call the one last race syndrome. And I think if you've heard of that, the concept is that horses on its way down in terms of performance at the racetrack, and somebody's just trying to squeeze the last drop out of it. And there's obvious reasons why that's not a good idea. It's obviously not good for the horse. because this horse is now not even a horse that can be used for any kind of an athletic purpose going forward, okay? But even for the owner of a horse like this, they would spend more in training bills on 1 or 2 months of training than they would have to just retire the horse and donate it. So again, it's an owner education piece, and it's something that we're working hard on right now to try to educate owners to identify, and we'll talk later about when is the time to retire a racehorse. Okay, 37. This is just another example of the same. I won't belabor the point, but this horse came off the track, has some significant findings, degenerative joint disease of the lower joint of the knee, and it was just too much for the horse. So I think, as you can see, it's less about the actual location and more about how far things have progressed. And a simple chip without the presence of degenerative joint disease, some remodeling changes, things like that, not the end of the world for these horses, and they can be very useful for just about any purpose. But once they get to this point, you can see that it's less about the fact that it's the knee and more about the fact of how far it's progressed. Okay, let's see, maybe we can skip one of those. Let's go on to condylar fracture. So just for orientation, this is your cannon bone. That's your first pastern bone, the 2 sesamoids, and a very common injury at the racecourse, at the racetrack, is a condylar fracture. This is the condyle, the lateral condyle of the cannon bone. And screw is placed here, compresses the fracture site, and in an uncomplicated case, many of them heal extremely well and go back to racing, and not even with necessarily a drop in class. So, so this is an example of a horse that has hardware in it, had an injury, it was well repaired, and it's not a factor going forward at all. I just showed you some serial radiographs because in this case, you may not be able to see it, but this is almost healed. There's a little bit of a line there if you looked at it very closely, but a couple of months later, you have full healing. And this horse is currently in usage as a dressage horse and is doing just fine. And let me, before I forget to mention it, you'd say, well, so does that mean that this injury is only good for doing dressage and it can't be a jumper? No, I'm not saying that at all. Because the part that you're involved with is your matchmakers. So if somebody is looking for a horse that is, just say, a dressage person, and they come in and fall in love with this horse, they're going to adopt it. So you don't get to necessarily determine the level. You're mostly just helping people to understand what might be a limitation and match it up to what their desires are or what their ability is. So just because this horse is only doing dressage doesn't mean that it couldn't be a very good jumper or an eventer or anything. For me, this injury as repaired, that horse is as good as new. There's no, that does not pose any limitations whatsoever. All right, let's see here. And here's another one. This is a pastern. So that's your cannon bone, sesamoids, first pastern bone. Had a fracture and was repaired with 3 screws, as you can see. And again, essentially good as new. Okay, that looks rather dramatic, doesn't it? I mean, there's a lot of stuff and a lot of hardware in there. For me, that is as good as no hardware at all. There's no reason to take it out. The horse is 100% sound. I would imagine, and I don't know, I don't have the history right in front of me, but that horse with that repair could potentially have gone back to racing. If there's no, and there are no changes at the joint surface, to me that's as good as new. And you can see that the horse was competitive and fine. But not all of those fractures turn out well. And here's one. So this horse had a condylar fracture, but it has, as a consequence, so a lot of degenerative changes in the joint. And I can sort of point some of them to you. It's got some changes on the top of the first pastern bone. This is what we call supracondylar lysis, which is an indication of long-standing inflammation. The top and the bottom of the sesamoids are sharpened. The condyles are, have got some changes in them, and essentially this horse has degenerative changes in the joint. So I'm going to look up the slide 43. Let's see. Yeah, so this horse came in with a right forelimb lameness. When I examined it, it was obvious that it was referable to that fetlock. And as you can see, and we talked about it, had a repair of the condylar fracture. And there were even comments from the surgeon that there was a significant amount of damage to the articular surface of the lateral condyle, and could be limiting factor regarding soundness in a second career. So already at surgery, this horse had already had some significant changes to the joint, and when it finally fractured, the fracture was repaired, and it was a very good repair, but it couldn't reverse the damages that were already done in the joint. So this horse doesn't have any opportunity to become an athlete. Unlike other condylar fractures that are repaired, it just had too much damage to begin with. And here's another one, and you can actually see that even though the fractures, sides of the fracture were compressed by a screw, that dark area there, that's an area where there's a piece of bone missing there, and you're getting changes at the joint surface, and that horse, like the other one, had soundness issues that just could not be resolved. Okay, here's a sesamoid fracture. This one was retired from racing due to a base fracture of the left front lateral sesamoid. On physical exam, he had a poor way of going, but due to multiple limb involvement, and both front fetlocks had significantly reduced flexion. And so on the radiographs, this horse has got the obvious base fracture. You can see the piece right there and right there. But it's got other things going on in the joint. And that's the problem. These things have been going on for too long. And so essentially this horse has already, because of the previous damage, it's just not going to be a good candidate for any future athletic endeavor. So this horse was permanently retired to pasture and had to be. Okay, here's this horse had a history of a left front mid-body fracture of the medial sesamoid, had surgery to remove 2 large fragments, and on the physical exam, the left front fetlock is grossly enlarged and has no ability to flex. So again, you know, they did a nice thing for the horse by removing the fragments, but essentially this horse can only be used for light trail riding or as a companion. And you'd say, so again, it's not the location, because there are many sesamoid fractures that actually end up fine. They either heal or an apical fragment or base fragment can be removed. But in this case, this horse was just too far gone. This is just a view of the ultrasound exam and looking at the suspensory branch that attaches into the top of that sesamoid. And you can see all these dark areas in here. The whole branch is completely destroyed. So that horse is not going to have a career. This is one that made me very sad, and I think you can see all of this stuff here. That's mineralization and degenerative changes, and you can even get an idea, even though on an x-ray, you're basically looking at bone, but you can see a soft tissue profile, and if you follow the arrow, this horse's ankles are huge. And there's no flexion there. This horse is done, and this horse became a companion horse. I mean, he was getting around okay in a pasture, but obviously, again, it illustrates that it's the severity of the finding and not necessarily the anatomical location. So, and then I thought I'd show you this one. I was actually involved. This horse was purchased in France as a yearling. And I don't know if you can appreciate it, but this little area here, there's a little dark area in the bone, and then that bright white halo around it is sclerosis. And at the time the horse was purchased, there wasn't much made of it, but that thing actually developed into a bone cyst, and the horse was really lame. And I was in touch with the veterinarian. The horse went to Florida. I was in touch with the veterinarian, so I knew the workup on the horse, and he did all the nerve blocking in order to isolate it to this area. And when you block the joint, the horse didn't go sound, but when you did a low 4-point, the horse did, and so presumably the pain is coming from its subchondral bone pain. It's not actually in the joint. So you say, well, you know, so this thing actually became a bone cyst, and what do you do with it? Well, put a screw in it, which is what we do in some of these bone cysts, most commonly in the stifle, but in this case, the first pastern bone. And this horse actually went sound and went into eventing, and is an eventer, a very successful eventer. So it's kind of an odd case, but another example of being able to intervene and actually have a usefulness for the horse. So, okay, let's see. Just going to take you through some soft tissue stuff quickly. This is a, I know you're all familiar with the term bowed tendon. It's basically, that's usually an injury to the superficial flexor tendon. And I have a number of these, and I will say that with maybe the odd exception, most of these horses do extremely well. And what they need, I think one of the worst things for horses is just standing in a stall. What they need is to be out. And I mentioned the importance of that 60-day period of turnout. Well, to give you an analogy of helping an injured soft tissue structure to heal, what gives a rope its strength is the fact that all of the fibers are parallel like this, and they're all tightly parallel. When a horse injures a soft tissue structure like a tendon, a superficial flexor tendon, or a suspensory branch, you get a lot of edema in there, you get broken tendon fibers, and when they're healing, they kind of want to heal like this, but there's no strength to that. And so what turnout does is it is passively stretching those soft tissue structures, and it causes them to line up in a parallel array. So you get a stronger structure when it's healed if the horse is turned out. If you keep a horse in a stall after it's had a soft tissue injury, you're not helping the horse. Now, maybe initially for the first week, maybe the horse is really sore and it's hot, but you know what I'm saying. There comes a point relatively quickly where it's actually advantageous for the horse to be using that. Turnout is excellent because horses tend to know how much to exercise themselves. And then if I have something, well, this is an example of one that has healed. They don't heal perfectly in terms of how they appear on an ultrasound exam, but that's okay. It's good enough for all of the purposes that you're going to use them for. It's just not good enough for racing. And so if something hasn't even completely healed, I still like them to go into early training, because early training is nothing more than walk, trot, go over poles. I mean, it's all just basic stretching, and I think it gives more greater integrity to those soft tissue structures as they're healing. So I have a strong aversion to keeping a horse in the stall for too much time. Let's see. I've got some cases here for you. Let me look at the time. Okay. I'll buzz through these and get to the end here. This is 53. Okay, this is a gelding that was retired from racing due to, apparently it had injured its right front superficial flexor tendon. They tried to rehab it, it re-injured, and so the horse was donated. And when I did my clinical exam, the tendon was enlarged but not painful to palpation. I did the ultrasound. You can see that there's a kind of a, what we call a mottled pattern. And this is a cross section of the tendon, and this is a longitudinal section. It's the same structure, just looked at two different ways. Again, there's been a lot of healing there. It's never going to be perfect, but it's good enough. So we initiated low-level training, and this horse is currently a hunter jumper, having no issues whatsoever. This horse, similar, injured its right front superficial flexor tendon, was rehabbed, tried to go back into race training, re-injured itself. So this horse was sound at the walk and trot when he came in. I palpated the tendon, didn't get any painful response. You can see that this is a cross section that I'm outlining of the superficial flexor. Yeah, there's a lot of dark areas in there, but it's mostly filled in, and that repair is going to be good enough. That horse went into training right away with that level of healing, and he's currently a pleasure and a dressage horse. And that's not to say that he couldn't have done something at a higher level, but apparently somebody that wanted to do pleasure riding and dressage came in, fell in love with him, and got him. Again, here's another case. We'll just go through it quickly, just to show you that I think you can appreciate that is enlarged, and it also has some dark areas in it, so that it's healed as well as it's going to heal, but it's healed well enough, and that horse was absolutely fine. I don't have any follow-up of what he's currently doing. Let's see here. So this is 50, yeah, okay, so this is a high suspensory, and sticking with the soft tissue theme, and this horse, I think you can appreciate, this is the high suspensory ligament, and all of this dark area is damaged. So quite a bit of, if you follow that arrow, there's only a little bit of it that is actually tending towards normal, and this whole area was damaged. So some time goes by, and you can see at this point there's been a fair bit of healing. It's certainly not perfect, and probably on an ultrasound image never will be perfect, but there's significant improvement there, and so we initiated low-level training at that time, and that horse was adopted out as a sound horse. I don't have follow-up for you, but it was a pretty significant injury. Now, it did take a long time. Let's see if I have the time frame. Yeah, it took about a year for this horse. So, you know, this is an outlier. You don't want to have all of your horses taking a year. But, you know, if it's a really nice enough horse and, you know, has the right temperament and you're moving in a positive direction, occasionally they do take that amount of time. Here's a high suspensory in a front limb, and you can actually see there's an actual fragment. I'm going to profile it out for you. It's probably hard for you to see, but I'm circling it there and there. And that fragment is embedded in the high suspensory. Let's see. Yeah, there's your high suspensory right there. And then this line down here is the back of the cannon bone. That's your suspensory ligament. Then you get into your check ligament, deep flexor, and superficial flexor. So you can see the step where that fragment was actually pulled out of the back of the cannon bone there. That horse had a very positive outcome. Is a hunter jumper and doing very well. So these things can heal. Sometimes they take a little time. That one didn't take as long. That was probably about a 6-month deal. But if you're patient on those, they can have a positive outcome. Similarly, same location. This is a high suspensory behind. I'm going to rush through this in the interest of time. But basically, this horse had a fair bit of damage. This is the suspensory ligament on a cross-sectional scan. You can see all that dark area is damaged high suspensory ligament. And unfortunately, this horse just, even given the time, could not overcome that. Okay, I'm going to skip some of these cases just so that we can get to where we need to go here. Okay, so stakeholder education is really important, and owners and trainers are not the only stakeholders. That group needs to be expanded to veterinarians. A large majority of these injured athletes would benefit greatly from the care of that an equine vet can provide, and I'm hoping that you have access to somebody that is interested in receiving these horses and trying to get them onto their next career. A lot of veterinarians, fortunately, understand the financial constraints that you're all under. And so hopefully some of these vets are willing to do some of this work pro bono or, at a reduced rate. I know in Lexington we have even a number of surgeries that will do, surgery on some of these horses at cost just to try to contribute to the cause. So when to retire a horse? There's usually 3 instances that I can think of. Horse doesn't have talent. It may be just slow, or maybe doesn't have the temperament for racing. If it has a serious injury that's incompatible with future racing, or if it has some chronic progressive issues that will or already have become performance limiting. So this you can just refer to. I think these are good guidelines. They come from the AAP, and basically to help people delineate when it would be appropriate to euthanize a horse, because you're going to get some of these horses in potentially, and you want to be able to, if it's appropriate, to be able to make that recommendation. So these are the 4 things that a horse should not have to endure: continuous or unmanageable pain from a chronic condition or an incurable one, medical condition or surgical procedure that has a poor prognosis for a good quality of life. You'd say, well, what surgical procedure? Well, maybe an arthrodesis where a horse is broken down and fractured both sesamoids and ruptured its suspensory in a front ankle or something, and needs to have, or has an option of having that procedure, but maybe it's deemed that it wouldn't be a good outcome for that particular horse. And in that case, it's a very legitimate and humane thing to do, to have euthanasia as an option. Continuous medication or box stall confinement for the relief of pain for the rest of its life, or an unmanageable medical or behavioral condition that renders it a hazard to itself or to its handlers. So those would be the 4 instances where it would be prudent to consider humane euthanasia. Let's see. Okay, so these are the take-home points that I'm sure you've all absorbed over this lengthy presentation. Bear in on the feet initially, even if there's not necessarily a history of of any foot issues. Pay attention to the neurologic status of the horse, very critical and can be subtle, so you need to be clued in on that, and even maybe, you know, kind of, since you're the first line of defense, you're the intake facility, maybe get with the veterinarian that occasionally comes in to evaluate these horses and start to look at the horses from those standpoints. A lot of these things you can just do yourself. You don't necessarily need the vet to do it. It's great if someone's there all the time, but I'll wager that most of the horses that you're bringing in, you're not calling a vet to look at every horse. You're calling a vet to look at the ones that you think might need to be looked at. So you can do, you know, you can basically get a baseline level of whether you think this horse may have some subtle neurologic thing going on. The prognosis for an athletic career is based on a combination of the site of injury plus the extent of the damage. So you've seen fetlocks that have had injuries that have been successful. You've seen fetlocks that haven't. And the difference is the amount and the extent and the chronicity of what they're living with. Same thing with knees, high suspensories, suspensory branches, tendons, all of those things. And this is really important, and this is an ongoing effort, education of clients to address that one last race syndrome. And that's an educational thing. You know, as I said, all parts of the industry work together, and I do feel that in the racing industry, as you know, we have an organization, an authority, a national authority now called HISA, Horse Racing Integrity and Safety Authority. And one of the things that they're pointing towards, they haven't been successful in implementing it completely, but the idea is that there needs to be, just like veterinarians need to have mandatory continuing education to maintain our licenses, we need to have trainers have mandatory continuing education in order to maintain their training licenses. And there should be some fundamental modules for them, and this is one of them. One of them needs to be, at what point do we say to an owner, you know, I think that we're starting to see something where this horse is either on a downhill trend, or I think this horse is lacking in aptitude for this job, something so that they can present to you a horse that has maximum usefulness in a second career. The horse is starting from zero when they hit you, because it's a whole new talent set that you're asking them, you're introducing them to, and seeing what they have aptitude for. But we don't want them so severely limited by being injured to beyond the point of any return at the racetrack. So those are what I think are probably the most important points of the presentation. And Mike, I'll leave it to you. If you wanted to have some questions, great, or if you want to just go right outside, whatever you prefer.
I'm fine if there's some questions. You know, it's your guys' seminar, so.
What?
I'm sorry, but why do we start horses here so young in the States? Because I've been to other countries and talked to the racing. Does this to me all the time. I've talked
Okay,
to
the questions
vets.
are over. Next.
I've talked to vets in foreign countries, racing track vets, and they don't understand why the Americans start.
Well, I'm not sure what countries you're talking about, because I go to England, Ireland, and France routinely, and they're all started. Now, when I say started, they go into training after their purchase as yearlings. And so that's everywhere.
I'm talking about actual racing.
Well, they have, I think you're right. They don't have quite the emphasis on two-year-old racing that we do. They have two-year-old racing, but it's a bit of a different attitude, and I agree. I think that we can tend to push these horses too hard in this country sometimes. The idea of two-year-old racing in most countries is to, obviously everybody wants to win, but to introduce the horse to racing, to getting it going, to assess what level of horse they've got so that they can put it under wraps for the next season. And you'll hear that frequently, as opposed to in the United States where we have year-round racing, which I think is an unfortunate thing in the sense that horses don't get time off. Usually in the European countries, they get several starts into them as a two-year-old to try to assess their talent level, and then put them up for the winter with pointing towards what they think is a suitable program entering into their 3-year-old year. So you're right, they don't press on them as hard. They do start training them at the same time after their yearlings, breaking and training, and they do race them, but there's not the same emphasis on pushing hard on the 2-year-olds. I agree.